Next, that is general physical examination. Now, before we go on to general physical examination, it's very important to note that one should lie down the patient on a comfortable couch, should stand on the right side of the patient, and make sure that the light is adequate, and one should undress the patient keeping in mind the modesty. And if the patient resists for undressing, then don't force him or her. First of all, when we approach to a patient for general physical examination, we introduce ourselves and we greet the patient, ask his name, and then we go on to a panoramic view of the patient to see his general body texture and status. Having said that, I'll proceed. My name is Dr. Farrukh. What is your name? Now, I'm going to examine you. Is it all right for you? Okay. Now, we start from the head of the patient. First of all, we'll see the texture of the hair, which will tell us that this patient is nutritionally well or not. And then we come to the forehead and we see the eyes. Can you look down for jaundice? Can you look up? Look up for anemia. Then we percuss the frontal sinuses, the maxillary sinuses for any evidence of sinusitis. And then we go up to the nares. We lift up the nose and we see both the nares to see the vibrissae and any deflected nasal septum. Then we move on to the lips and we see the gums. Open your mouth, and we look into the throat. And having said that, then we use the tongue depressor, keep the tongue inside, depress the tongue with the tongue depressor and ask the patient to say ah. And then we look around to see the teeth, the gums and the buccal pack. Afterwards, we go to the chin, we look at the ears, we look at the neck from the front and from the side, and then we look for the cervical lymph nodes and any thyroid swelling. And then there are two ways. Either we can go down from here or we can go up to the hands. We look at the palmar as well as the dorsal surface of the hand, and then at the level of the patient we look for the clubbing, and then we feel for the pulse for 15 seconds, and then we check for the blood pressure while the patient is lying. Then we move up and we feel into the axillae for any lymph nodes. Then we go down, look at the skin, and then we go down to the feet. We look for the edema at the upper part of the medial malleolus. Then we feel for the dorsalis pedis pulse. And we make the patient sit up. And we feel for the thyroid from the back and ask the patient to swallow. The detailed examination will be elicited later on when we examine the thyroid. Then we look at the back for any spinal deformity, if there is any, and look for any tenderness. And then we check the blood pressure while the patient is sitting. Afterwards, we ask the patient to stand up. Stand up. And either we can check the blood pressure while standing up for any orthostatic hypotension, and then we ask the patient to walk to see the gait of the patient. Then we ask the patient to come back and help him dressing up, and thank you the patient and present your findings to the examiner. Now make sure that you do this examination step by step. First of all, you examine this patient while the patient is lying down. Then you examine this patient when the patient is sitting up, and then when the patient is upright. It is no point to make this patient sit up, stand up, lie down, again sit up, because this will cause wastage of time and the sequence of your examination will also suffer. We move on to the different commands in general physical examination. The first one is how to assess the nutritional status of a patient. Now, as you all know, before you go or approach to a patient, you have to follow the steps which I have already mentioned. That is, the patient should be lying down on a couch comfortably. You should be standing on the right side of the patient. There should be adequate light. You should you should introduce yourself to the patient and greet the patient and ask his permission to examination. And every patient, whatever command you are given, try to assess a general or panoramic view of the patient. So I'm not going to repeat that in next commands all the time. This should be understood, and it's been well elaborated in the text. As far as nutritional status of the patient is concerned, you just have a panoramic view of a patient from head to toe and see the general build of the patient. And then you start from the hair. You see the texture, because in some nutritionally depleted patients, the hair texture also becomes coarse, rough, or they become very sparse. And then you look at the temporal area to see any wasting. You look for the eyes if they are sunken, and then you look at the cheeks or the buccal pad of fat if it is wasted, and then you come across and feel for the fold of the fat at the triceps area, and sometimes you can feel at the lumbar areas. And then you look at the tongue, and then you look at the angles of the mouth for any nutritional deficiencies. And then you assess the overall state of the patient and redress the patient, thanks the patient, and then tell your findings to the examiner. Now the next command is look for pallor. Make sure that you understand that there's a difference between pallor and anemia. Pallor is what you elicit clinically, and anemia is what you see on the laboratory investigations. Having said that and completed all the other steps, ask the patient to look up and see both the lower conjunctiva to see any pallor. Ask the patient to open the mouth and put the tongue out, and you see for any pallor in the tongue, and then you ask the patient to roll the tongue up and see the undersurface of the tongue, especially the frenulum linguae. Now you compare the palm of the patient with your own hand if your hemoglobin is normal. Normally if you see the palm is pale, pink, but the creases are pinker than the palm. That's a normal hemoglobin. If the palm is pale but the creases are pinker, then the hemoglobin is around 10. But if the palm is also pale as well as the creases are pale too, then the hemoglobin is less than 8. It can be 3, it can be 4, it can be 6. Then you ask the patient to redress, thank you him, and you present your finding to the examiner. Cyanosis, that may be a command in the examination. You start from the tip of the nose, look at the ear lobules for any bluish discoloration, look at the lips for any bluish discoloration, look at the tip of the tongue and the buccal mucosa, and also look at the gums as well. And then you go on to the hands, look at the nail bed for any bluish discoloration. Now sometimes it is important to know whether it is central cyanosis or peripheral cyanosis. If you ask this patient to take few steps up and down, then the central cyanosis will get worse, whereas the peripheral cyanosis may disappear. Ask the patient to redress, thank you him, and present your findings to. Look for clubbing. For this, you have to see the nails, the nail fold angle, which is called the Levi-Bond angle. You have to look at the level of the patient when there is obliteration of the angle. And then you ask the patient to do like that, and it should obliterate the space. This is called Shamroth sign if the space is obliterated. And then hold the nail and try to cause any fluctuation if the nail is fluctuant at the nail bed. And then you look all the fingers of both hands and then the feet, and then present your findings to the examiner, and of course redress this patient and thank you. For jaundice, for this you ask the patient to look down and see the sclera above the cornea, and it should be yellow if it is jaundice. Then ask the patient to open the mouth look under the surface of the tongue for any yellow discoloration of the frenulum linguae, and look into the buccal mucosa for any yellow discoloration over there. And look for any discoloration, especially the yellow on the skin of the patient, and look at the palms for yellow discoloration to confirm the findings of jaundice. Then redress the patient, thank you the patient, and present your findings to the. Check for cervical lymphadenopathy. For this, we have to inspect the patient for any opening sinuses in the neck from both sides, from the right, from the left, and from the front of the patient. Then you move on to the back of the patient, ask the patient to flex the neck a little bit forward, and then you feel for the cervical chain, vertical chain on one side, then the horizontal chain on one side, then the vertical chain on the other side, and the horizontal chain on the left side. And then you start from the submental, submandibular, jugulodigastric, preauricular, postauricular, and occipital lymph nodes. Afterwards, you redress the patient and thank you the patient and present your finding to the examiner. Check for a scalene lymph node. For this purpose, we ask the patient to flex the neck and turn face towards the opposite side. Then take your tip of the right index finger and go between the two heads of the sternomastoid, that is the sternal head and the clavicular head, and you push your finger downwards, making sure that this finger is pointed towards the downwards and lateral on the left side at the site of the apex, and ask the patient to breathe deeply, and then you will feel that something hard is touching your tip of the finger, and that is in the enlarged scalene lymph node. Examine the lymph nodes of axilla. For this purpose, we place the right arm of the patient flexed at the elbow and use your right arm, the palmer's aspect, to feel for the lateral wall of the right axilla and the apex as well. And then you put the right arm on your right arm and use your left hand to feel for the medial aspect of the axilla and the apex. Similarly, you put your put the patient's left arm on your left hand and use the right hand to feel for the left medial wall of the axilla, and similarly you feel for the lateral wall of the left axilla with your left hand. And then you redress the patient and thank you him and present your exam findings. The other way to do this is you go at the back of the patient, ask the patient to hold like that, and you feel for the posterior walls for the axilla. check lymph nodes in the inguinal region. For this purpose, you adequately expose the patient, keeping in modesty, and then for right side, you flex the left leg of the patient and then keep it there, and you roll for feeling for any lymph nodes. Then you do it on the opposite side as well with your left hand and feel for any enlargement of the lymph node. Redress the patient and thank you. Look for peripheral edema. For this, we expose the patient properly. We press with the right thumb the posterior part of the medial malleolus for 20 to 30 seconds, or the lower part of the shin for the same duration, and feel for the formation of a dimple or well. If there is a dimple, it means that patient has got edema. If the patient is lying for a long time, ask the patient to sit up, and at the back of the patient, at the sacral area, press with your left thumb for the same duration and look for any dimple or any well formation. That will again confirm the sacral edema. Redress the patient and present your findings. Check for the radial pulse. For this, you flex the arm of a patient and then flex the wrist of the patient a little. Put the three fingers, index, middle and ring finger of your right hand, and press with the proximal, with the index and with the ring finger, the radial pulse, and with the middle finger you feel the pulse for 30 seconds. You rub the artery against the radial bone to see the texture of the vessel wall. At the same time, you compare or you feel the femoral pulse with your left hand to see for any radiofemoral delay. For pulse at the dorsalis pedis, you go down from the first interosseous space up to the dorsum and you press with the fingers and feel for that. And for posterior tibial, you feel behind the medial malleolus and you compare all these pulses. Check for carotid pulse. For this purpose, we ask the patient to flex his neck and then turn a little bit on the opposite side. You feel for the carotid cartilage and the anterior border of the sternomastoid, and with your left thumb you press it and feel for the carotid pulse. But make sure you do not feel the carotid pulse both at the same time. Otherwise, the patient can collapse due to parasympathetic overstimulation. Check for water hammer or collapsing pulse. For this purpose, before we proceed on to this examination, we ask the patient whether he or she has any problem on the same shoulder joint or not. For this purpose, we flex the elbow, place the palm of your right hand across the patient's radial pulse and feel for any impulse if there is any. Then put your left hand behind the patient's right elbow and suddenly lift the elbow up, and then you will feel the thrust of the radial pulse onto your palm. This will confirm that this patient has got a collapsing or a water hammer. Check for pulsus paradoxus. Now this is an important examination as far as general physical examination is concerned. For this we have to use a sphygmomanometer. For this purpose we apply the sphygmomanometer, cuff, like this. Feel the brachial artery. Inflate the mercury above the systolic pressure and then ask the patient to take deep breath in and out. Lamba saans lo. And you keep on lowering the mercury level. Lamba saans. Lamba saans. Roko. You note the time when it's expiration लंबा सांस, and you note when the crotocough sounds are heard during inspiration. The difference between the two levels is your pulsus paradoxus. Check the blood pressure. For this, we apply the sphygmomanometer cuff 2.5 to 5 centimeter above the decubital fossa and 2.5 centimeter below the axilla. And then we feel the brachial artery and we inflate the cuff, and we feel first palpatory method and then we deflate it. Again, the diaphragm, the stethoscope is put on the brachial artery, the cuff is inflated up to a systolic level, above the systolic level, and then it is deflated gradually. Make sure that it is deflated 3 to 5 millimeter at one time. You note when the sounds they appear and note the level of the mercury when the sound disappear, and that will tell you the systolic and diastolic blood pressure. Blood pressure in the lower limbs. For lower limbs, we have to place the cuff on the mid thigh. For this purpose, we need a long cuff. But in case you don't have a long cuff, then you can put the cuff on the calf and do it accordingly as we are doing it. To measure the blood pressure in the thighs, you ask the patient to lie prone and put the cuff over the middle of the thigh and then feel the popliteal artery. Then you inflate the cuff and then put the stethoscope diaphragm over the popliteal artery and you measure it as you do in the upper limbs. But the other method to measure blood pressure in the lower limb is that you apply the cuff in the mid calf, you inflate as you do normally, and put your stethoscope at the posterior tibial artery or the dorsalis pedis artery and deflate the cuff and measure the blood pressure. Check temperature of the patient. For this you have to use a sterile thermometer as in my hand, and you look at the mercury level before and then you shake it well below the desired, below the normal mark. Ask the patient to open the mouth. Make sure that the patient hasn't had anything very warm or very cold recently. Ask the patient to lift the tongue up, and on one side of the frenulum lingui, zaban band, muh band, you place the thermometer for at least 1 minute. But at the same time, you instruct the patient not to bite the thermometer with the teeth or not to rub the tongue against the thermometer, because that can either damage the thermometer or can give you a false reading. After, you remove the thermometer and look at the level, and that tells you the temperature. Examination of the thyroid gland. This is an important examination in clinical scenario. First of all, we look as a general look on the patient as a panoramic view of the patient. Then look in front of the neck and then from the side of the neck. Then ask the patient to take a sip of water. Ask the patient to take a sip of water, but don't swallow. Then ask the patient to swallow. And you see that there is a movement of any swelling if the thyroid is involved. Ask the patient to put the tongue out and see whether anything or any swelling moves in front of the neck to exclude any thyroglossal cyst, etc. And then you go on to this side on the back side of the patient. Put both hands in front of the neck, flex the neck a little bit forward, and put both your thumbs on the back of the neck of the patient. Tilt the neck on one side, and from the other hand, from the left hand, push the trachea on the opposite side, which side you are going to palpate. And then you feel or you palpate the upper and the lower part of the right lobe, and similarly pushing the trachea to the opposite side, you palpate the upper and lower part of the left lobe. And afterwards you can listen for the breathing. Ask the patient to hold the breath. Put the diaphragm of the stethoscope in front of the thyroid and listen for any breathing. Having done that, look for other signs of hyper or hypothyroidism, which have been described in detail in the examination of patient's throat. For this purpose, before you go into examination, ask the patient whether he or she had any recent meals or not. Ask the patient to open the mouth and keep the tongue inside, right? And with the press the tongue posterior 1/3 first and look around, and then press the interior 1/3 and look around, look at the buccal cavity, and just touch the pillars to see for any gag reflex, and also look at the posterior pharyngeal wall. Look at the patient's tongue. For this purpose, ask the patient to open the mouth and direct him to keep the tongue inside, and look for any abnormality on the surface of the tongue in the form of atrophy or fibrillation, and then look at the side of the tongue for any ulceration, etc. Ask him to lift the tongue up and look at the frenulum linguae for any color changes, for any telangiectasias. Then move on. Ask the patient to wiggle the tongue inside, and this side to see the power of the tongue, and the tongue can be moved easily. As far as palpation of the tongue is concerned, for this purpose you have to wear gloves, and you have to hold the tongue with one hand and then feel for any induration, especially if the ulcers are present, to rule out whether they are malignant or not.